Hello everybody! In this video we will be covering some in-depth information of art therapy as a treatment option for kids and adolescents. We'll be exploring what art therapy is, the therapeutic benefits that research has supported, and what to expect in a session for your child. So up first, let's introduce you to what art therapy is. According to American Art Therapy Association, art therapy is defined as a mental health profession that enriches the lives of individuals, families, and communities through active art making, creative processes, applied psychological theory, and human experience within a psychotherapeutic relationship. Now, in clinical practice, materials like drawing, painting, or sculpture are used intentionally as part of treatment to help therapists understand your child's conscious and unconscious emotional experiences. The main focus is evaluating the creative process of art making rather than the quality of the final product. That is, we are focusing on what creative choices that your child is going to make to express their emotions. For example, like the colors or the texture of the artwork. Now, lastly, art therapy is guided by a licensed art therapist with a master's level or higher degree training in art and therapy. The educational standards for art therapists require that they must complete at least a graduate level coursework that includes training in psychology, assessment, research, and supervised clinical practice. For example, one thing that they learn is psychological development, which allows them, art therapists, to understand how various emotional, cognitive, and social milestones shape a client's mental health. This knowledge then allows therapists to understand the different emotional needs between children and adolescents, which helps them inform therapy sessions and treatment paths. During an art therapy session, your child with the art therapist will first establish a goal, choose appealing mediums, and then the therapist will provide your child guidance to the creative process. Once the art making process is done, the therapist will encourage the reflection of the artwork. Let's say your child comes in to an art therapy session wanting to discuss their relationship they're having a problem with their friend. So first, the therapist is going to ask them what goal they're hoping to achieve. And the child may think, hey, I want to talk about my feelings about this relationship I have with a friend. Then the art therapist will give your child an option of mediums to work from, like sculpture, painting, drawing, etc. And your child can pick which medium they want or mediums that they want to work with to help them express their emotion. So let's say your child decides to go do drawing with markers or crayons, something like that. The therapist will then prompt them to draw their emotions or their feelings about this particular issue. And based on the child's process of making the art, the therapist will ask guiding questions that prompt or encourage reflection on their emotions. So let's say your child is using a lot of blue colors or dark blue colors, something like that. The therapist will then be like, hey, I've noticed that you're using a lot of dark blue colors. Why is that? Or what is the reason that prompted you to do this? What feeling is associated to this blue color that you can think of? It may be hard for the child to communicate this, but the art then helps the child think and reflect on their choices. And at the end, when they're all done, the child could either keep the artwork or they could throw it away. They could literally do anything to it. We absolutely do not care about the quality of the artwork, but rather just the emotional expression that was going on through the art making process. That's the most important part. In a systematic review in the Australian New Zealand Journal of Psychiatry, they found that art therapy has the power to stimulate cognitive abilities, reduce stress and anxiety, improve self-esteem and self-awareness, become a form of non-verbal expression, and encourage emotional expression. According to the National Library of Medicine, research has revealed a direct correlation between art and brain function, which means art therapy may also help improve cognitive abilities. For kids and adolescents who may have an undeveloped brain, art therapy then helps stimulate cognition by engaging multiple areas of the brain, such as the prefrontal cortex, to improve memory, attention, and problem-solving skills. According to American Psychological Association, kids and adolescents often deal with stress, whether it be from school, social challenges, family changes, and/or other significant life events. When left unmanaged, stress can interfere with a child's brain development, learning, immune system, and long-term health, increasing the risk for health conditions like anxiety and/or depression later in life. According to the book, Understanding the Psychology of Art Therapy and Benefits, art therapy can improve self-esteem and self-awareness. There's a natural sense of pride that develops as a kid and adolescent overcome their emotional challenges through producing an expressive art piece of their own. The process of creative art making and expression helps deepen their understanding of their feelings as they reflect upon their creation, which also helps to foster healthy coping mechanisms and emotional regulation. As kids are navigating through their complex emotions, it is important to help them develop healthy coping mechanisms and skills to prevent unhealthy ones like self-harm from happening. Art provides a creative space for emotional expression. One of the most difficult aspects of managing emotions for kids is learning how to release them, especially when they try to find it challenging to talk about their experiences and put words to their feelings. This is a common issue for kids and adolescents as they often experience and express their emotions physically or behaviorally rather than verbally. Art therapy then offers an additional non-verbal mode of expression that allows these to be explored symbolically and visually. Now here are some kid testimonies from the Art Therapy Institution. One child that is age 9 said that if you are angry or sad, then art therapy can help make you feel happy. Making art and speaking to my therapist calms me down, and together we work on options to help with friendship problems. Another kid said, art therapy has helped me express myself. I'm able to take out my stress using different art materials. I worry less now and have learned ways to cope and deal with my anger. I know now that I can cope by myself. Without art therapy, I would probably still be worried and stressed. So who can benefit from art therapy? Anyone. Anyone of any age facing emotional, mental, or physical challenges, including children, adults, and seniors, especially those with anxiety, depression, trauma, developmental disorder like autism or ADHD, or chronic illnesses like cancer, will find it very helpful in art therapy. But art therapy is especially effective for those who struggle with verbalizing feelings. So, going into art therapy, your child will be working with various types of art materials, and this is including but not limited to drawing and painting, sculpting and clay work, collage making, and mindful art making. So, we're going to talk a little bit about the common misconceptions that people have of art therapy, just to clarify things a little bit. So, number one, you need to be an artist or at least be good at art. That is absolutely false. Alright? Art therapy is focused on the creative process of art making. We do not care whatsoever about the quality of your child's artwork, but rather focus on making art a tool of expression. In fact, we encourage your child to create ugly art without being restrained by perfection, and it is the most effective way to express yourself without the fear of judgment. Number 2, art therapy is just arts and crafts. That's absolutely false. According to Melissa Weaver, a professional art therapist, art therapy is so much more. It's a mental health profession. An art therapist needs a master's degree in expressive therapies and 1,000 postgraduate hours of supervised client contact before they are eligible for certification as a registered art therapist. Mind you, these licenses take a lot of time and effort, which means that it entails a higher level of training and experience than just a simple arts and craft activity. Additionally, the therapeutic value that comes from art therapy is not just from simply creating art, but also reflecting on your emotions and creative process. And this reflection is encouraged and prompted by an art therapist by well-timed and intentional guiding questions that are asked throughout the art-making process. So if your child is interested, or you think your child will be interested in art therapy as a treatment plan, then here's how you can get started with art therapy. So first off, look for licensed art therapy in your area. And websites and mental health directories often provide information about therapist specialties and methods. Secondly, check for credentials. Ensure that potential therapists are qualified and have the necessary training. Many art therapists hold professional memberships with reputable organizations, so you can go check over there. Number 3, schedule a consultation. Most therapists offer initial sessions to discuss your goals and determine if art therapy will be a good fit, and use this opportunity to ask questions and have your child or you as a parent express your concerns. And finally, once you're all set up, begin your healing journey with art therapy. Okay, so that's the end of this info session. Thank you for listening. I hope this overview helped you better understand the clinical role of art therapy and how it may support your child's mental health and emotional development as part of a professional treatment plan. All right, goodbye.